Okay, so when we go to the posterior hip, you'll remember that's the crossover where we stretch the back. You want to make sure that it stays focused in that specific area. We don't want it traveling to the side of the hip or down the leg, or you don't want to feel anything in the groin. Keep that really focused in the back so that you know we're working on the right area. With this, what we're going to do is, it's the same thing. It's the femur and the pelvis, the ball and socket, where they come together. We need to create motion in that joint. And what we're going to do is we're going to lift the leg up and cross it over. And that movement back here in the hip is what creates the stretch in the butt. Now you know, regarding what we were talking about yesterday, your body's going to follow the path of least resistance. So the first thing that's going to happen is when you bring this leg up and across, the pelvis is going to want to go with it. Okay? But that's what we're going to do, is we're going to use your other hand to then go and block the pelvis to drive the motion. But then when you do that, you're probably going to try and bail out in some other way. So I'm going to try and walk you through how I would do this to myself and get you to duplicate for a maximum effectiveness. The first thing is you want to see from this side view is that your knee is going to go down like onto a pillow. Okay? If you don't have something low like a bench, it's fine. You could do it on a table. Your knee just will not touch the ground, and that's not a big deal. So what I'm going to do from here is I'm going to put my hands down and cross my leg over, and then slowly I'm just going to let this knee down. From this position, then I'm going to show you in the front here how I want your legs to be positioned. Okay, the most important thing that we want to gather here is that your thigh and your leg and your hips kind of form this box, okay? A box like this. Can't really hold my balance here, but a box here. And I know that once we've got that box formation, it's going to start to get us into the right place. But you'll see here, just like yourself, the knee's not going to probably be down to the bench day one, possibly for longer. Number two, you'll see that my knee is to the outside of my hip. My right hip is right here. I really want my knee and my hip to be in line. And then I want my shin parallel to my pelvis. Okay? Right now my pelvis is pointing forward, but as I shift, it's probably going to compensate a little bit. So what I'm going to do to get this alignment better is I'm going to move my down knee, and if you're not on your knee, you move your down foot under the body. So I'm going to come across the body until my knee gets more positioned in front of the hip. Now you probably won't be able to go all the way in front, because if you try and move your knee in front of your hip day one, you're probably going to start to feel more in the top and less in the back, and you don't want that. So you might have to allow for a little bit of compensation to occur. The second thing you're going to do is you're going to then take this arm and you're going to block it here, because now we don't want any more movement from these bones. We want these bones to stay exactly where they are. You're going to take this hand and you're going to grab your pelvis, and you're actually going to wind it this way. You're going to turn it to your right. Meanwhile, you're blocking with your right arm your thigh from moving. So as you're doing this, the motion's coming very specifically from the back there. Now what can help with that is when your knee is down, that you can actually turn your foot, you can kick your foot out, which turns your hip in, which brings your pelvis around the corner. So it kind of does the job for you that what you're trying to do with your hand. So again, you're going to block the knee, make sure you're as close into the box formation as you can tolerate, kick that foot out so your hip's twisted in, and then use your hands on your pelvis. You can lean forward a little bit into this, and you're literally trying to squeeze yourself like this. This arm's pulling your leg, this hand's driving your pelvis, and the closer you bring those together, you're going to really start to feel the outside of your right hip. I would go into it as deeply as you can tolerate for 10-second holds, and I would do that for 1 to 2 minutes. We need to really get in there, and we need to create a new path of less resistance for you, so that when you're on the field functioning and moving, your body starts to automatically choose this new range of motion that you've created.